My name is Liz and I'm a member of the clinical education team. Now we're going to look at a psychotherapy note. This is appropriate for clinicians in both the inpatient and the outpatient setting. The workflow is very similar. You use the exact same fields. This note is appropriately used by a licensed addiction counselor, a social worker, family counselor, for example, who's doing individual therapy, clinical psychologist, etc. Let's go down here, and we're in the chart phase for Snow White. And we're going to come down here and we're going to go into the second note. We call it in ICANotes the progress note for the non-RX or non-prescribing clinician. Think of this as your individual psychotherapy note. Let's go ahead and open this. And like most of our individual notes, daily notes that you're going to be using, it's just one tab that you have to fill out here. And we're going to work our way down, keeping in mind that this note could be done in either an inpatient or an outpatient setting. I do want to draw your attention to these custom buttons right here. For example, if I click one, splitting behavior by Snow is occurring with our office staff or our hospital staff. These custom buttons work in this field here, whereas these custom buttons over here work under instructions, recommendations, and plans. Once again, if you click a button and you're not going to be using it, you've made a mistake, you changed your mind, you just highlight it, right click, cut, and you can start over again. We're going to start right up here under clinical status and complexity. We're compliant with Medicare and Medicaid, and they like us to say how the patient looks today compared to the last time that you saw the patient. And I'm going to say your patient or my patient today has made a partial response to treatment. So it just puts in Snow's name. Snow shows a partial treatment response. Very simple sentence. And we're going to come down here. We do have symptom buttons for psychiatric symptoms. Those of you that feel comfortable with this and like to go into this level of detail in a psychotherapy note are welcome to come in here and say, for example, that she denies anxiety today, or she denies depression, or she denies any evidence of withdrawal symptoms. On the other hand, if your patient is having symptoms, let's go ahead and choose anxiety again. Instead of saying denies anxiety, let's say Snow continues to have anxiety. So we're going to click that C list right here. And we're going to be able to choose from the different anxiety symptoms specific for her. So she has positive anxiety symptoms. I want to stop here just briefly for a minute and show you that if your patient doesn't have generalized anxiety, but rather has agoraphobia or generalized anxiety disorder or PTSD, let's look at PTSD just as an example. And you look at the symptoms for that. The symptoms we're going to show under this area are going to be symptoms, the type of anxiety symptoms that are very relevant to PTSD, recollections and dreams and flashbacks and having a restricted affect and what have you. But for our patient today, she doesn't have PTSD. I'm going to come over here and click she has just generalized anxiety symptoms. And that these symptoms continue, and they are essentially the same as they were the last time you saw her 1 or 2 weeks ago. And I can come down here and I can click as many symptoms as she endorses today. I'm going to say she's a little bit apprehensive, but this is getting better. Feelings of derealization are absent today. She's no longer as embarrassed as she used to be. She continues to be somewhat irritable. And I'm going to come down here and I'm going to say that her exaggerated startle response is about the same as it has been. Okay. Notice that if you're working with children, we also have a couple of children's symptoms down here. Clinging children, crying children. You could make custom buttons here. Temper tantrums if the child was asked to enter the preschool or what have you and is still crying 30 minutes later. All right, let's go back here. And we've talked about our anxiety. And I'm going to say, just for fun here, that she says, I don't have any feelings of depression today. My depression has really lifted, so that's great. I'm just going to click this button here, denies depression. And it puts down here, it's a problem pertinent review of another psychiatric symptom, and it says, she or Snow describes no depressive symptoms today. Let's work our way down. We give you lots of options. You don't have to go into every option. Go into the options that are relevant for your clinical type of note and for your patient that you're seeing today. You don't have to click extra work areas. On the other hand, please don't make a scanty note just to get through it quickly, because you can use our buttons to generate your note very rapidly. I'm going to come over here under behavior. And instead of saying her behavior is normal, I'm going to go in here and look at the work areas. And I'm going to say she is taking her medication. Socializing with others is still reduced. Impulses are only partially controlled, and her sleep is just fair. So notice I didn't click all of the areas, I just clicked the areas that made the most sense for Snow White today. All right, we're going to come down here and talk about therapy. We have two sections for therapy, the verbal content of therapy. This is what the patient spoke to you about today. And then we can go into therapeutic interventions. This is what you said to the patient. So let's go into verbal content of therapy. And once again, we're going to ask you to let the program do most of the heavy lifting for you. Under content of therapy, I'm going to just start at the top here and say that she talked about her family, a little bit about impulsivity and self-defeating behaviors. Of course, she talked about anxiety and also some shame that's associated with that. I do want to show you that if your patient tells you something very particular in therapy and you'd like to capture that, you can always start to type it in. And a nice thing that you can do is I have two shared buttons here. They actually, I think, say the same thing. But if I click this, it puts in this following sentence: Snow shared the following important details during our session today. And I might start off with Snow saying, my husband, etc., does not believe in therapists or psychotherapy, and he's giving me a hard time about coming to therapy, and this really worries me. I'm afraid he's not going to let me continue. So whatever it is that the patient had told you that's extremely relevant to her, you could use a button like this to link the hardwired buttons with information down here that you'd like to type in about your patient. And you could really use this kind of a button on any of the tabs in our program to accomplish that same feat. I'm going to go forward here into therapeutic interventions. And this, of course, is what you talked to the patient about today. And I'm just going to come down here and say that you were, you assessed the type and severity of her problem. You helped her gain insight and understanding into her illness. You educated her about her symptoms. You offered support, identified precipitants for her anxiety, helping identify the precipitants of certain feelings, behaviors. And I'm just going to type in here real quickly. And anxiety were also provided today. Get a little space here between behaviors and anxiety were also provided today. Okay, maybe you talked to her about the importance of compliance with her therapy, and we'll skip the rest of these. Let's go ahead and go back into our work area. We've talked about the verbal content of therapy and what you talked to her about today. We do have rating scales in here. If you use them in your practice, feel free. If you don't know what they mean, you can hover over each one. For example, the first one, the CFARS, is the child's functional assessment rating scale, assesses cognitive, social, and role functioning in children. So we have all sorts of scales in here. I think we have a Beck anxiety inventory. Most of these would be done either through the patient portal, if you're using our patient portal, or on paper, and you could upload it and drop it into the patient's chart, and then you could document that the Beck anxiety inventory was done today in this shrub area. So let's say that she came in with a score of 28, and her exact score is 28. So it gives you a nice little paragraph here. The BAI multiple choice self-report promoting test that measures the severity of anxiety for adults and children. Her results showed her to be at moderate to severe anxiety. She scored between 19 and 29, and then it gives you her exact score of 28 right here. You can push in as many of these as you'd like to. Once again, that information is showing right here. Let's come down here. Mental status exam. We've already done this in our complete evaluations and in our biopsychosocial assessments. I'm going to run through here very, very quickly and talk about her appearance. She is glum, she's distracted, and she is anxious. Speech and language are fine. Her mood is euthymic today. Her affect is normal. Association's normal. She's not psychotic. She's not suicidal. This obviously is a mental status exam that's geared more for the outpatient setting than the inpatient setting, but you could definitely turn this into a very nice inpatient note, mental status exam as well. I'm going to skip down here to anxiety. I'm going to say her insight is fair, her judgment is fair, and that she does have signs of anxiety. I'm going to go into the C list and say she's restless, she's fidgety, she has an exaggerated startle response. These are things that I'm observing about her today. Her attention span, is a little bit distracted. She's somewhat restless, and her behavior is otherwise normal. She's not withdrawing from drugs or alcohol, so I'm just going to click right here. Typically, if you did, most therapists don't do vital signs, but you could go into this area to capture vital signs if for some reason you needed to do that. Let's go back. Notice that once again we're getting red X's in each of the areas that we've already worked in. You can justify level of care. And it says, it gives you a choice here. The program says, do you want to justify level of care statement under the history or under instructions, recommendations, and plans? I generally put it under the history area. It really is a personal choice. I don't think it matters one way or the other. I'm going to go with an inpatient level of care since on a prior training video I did an outpatient one. So let's say that this patient is in the inpatient setting. I'm going to say inpatient care is still needed. I could certainly say outpatient care is still needed. I'm going to say this patient is a court-ordered patient, and what's going on with her? She's inattentive and impulsive with behavioral disturbance and severe stress within the last 48 to 72 hours, for example. You can add more than one of these into this area. For example, if she's also been sexually inappropriate, you could come down here and add that. I'm actually going to make a separate paragraph for that. She's been sexually inappropriate with behavioral disturbance within the last 72 hours. And notice I just clarified this by saying in group settings. I could put down towards both peers and staff. I could make buttons here, towards peers, towards staff, towards both peers and staff. You get the idea. Let's go back. And we're almost done here. We're going to link to the treatment plan. This is a nice feature that can be done from any type of progress note, including the psychotherapy note. We're going to click here. And remember, Snow White had one problem. It was anxiety. It's still an active problem, so it's showing here as an active problem. I'm going to erase this header, and I'm going to show specifically that I'm linking to the treatment plan. This is a little workflow that I like to use. It's not mandatory. And when I click on anxiety, watch what happens. It pulls information from her treatment plan, all this great information that we've just put in her most recent subsequent treatment plan. You can see that she's met a couple of her goals. She has one goal that still needs to be met next February. She's making good progress in her interventions. You've given her an additional intervention to work towards. And you can come down here, and below the dotted line, the program gives you the option of saying, is she making any progress in meeting these goals or resolving these problems? And I'm going to say, gosh, she's making good progress. And what is my plan? And I'm going to say, I'm going to, let me see. I'm going to add some new short-term goals the next time I go into her treatment plan. Okay. I do want to stress to you that this is something that you can do in between treatment plan meetings and document in your progress note, your psychotherapy note, or whatever type of note you happen to be working in. This information stays in your therapy note. It does not push back into your treatment plan. Okay? Let's go back. By the way, if she had a second problem, depression or chemical dependency, you could elect to come down here and talk about each one. Is she making progress? What are your plans moving forward for that particular problem? And it would show one below the other in a scroll. Let's go back. Okay. We have a suicide and violence risk assessment that we've looked at earlier. Here's our diagnosis. We can come over here and say that this was maybe a 45-minute session, and that since we're therapists, I'm going to put down that we started this at 1400, and the program should tell me that it ended at 1445. Here are my notes and risk factors. I don't need to change anything here. I am going to print this out of my note. I could override it and decide not to if I felt strongly about that. I am going to include my diagnosis, but I could omit it if I wanted to. Medical history, I'm not going to include in my compiled note. But if there was something really big going on in her medical history having to do with her acute anxiety today, maybe I would elect to go ahead and include that in this psychotherapy progress note. Let's come up to the top here and say we're going to do a return visit with her in 1 to 2 weeks or earlier if needed. You can come in here and enter a service code. You can actually start at the top here with that short list of codes that are set up in settings and directories. I'm going to come down here, and we just did psychotherapy for 45 minutes. I'm going to enter in a 90834. 90834. We can just ignore these dollar figures. They're just there for demonstration purposes. And I'm going to select done. And now, under instruction, recommendations, and plans, remember we had linked to the treatment plan? Linked to the treatment plan. That information doesn't show over here. It actually shows over here under instructions, recommendations, and plans. So you can see all that. And what I'm going to do is come below this and put down my clinical plan for the patient today in the same field below my link to the treatment plan. So clinical plan, it's a nice little header, and I'm going to say that we talked about some options for medication if her anxiety doesn't clear. We might send her to see a psychiatrist, for example. What else did we do? Maybe she talks about getting highly anxious when she's parenting her children, so maybe I have a button here for parenting skills. Let's go ahead and pop that into. Here we go. This actually turned out to be one paragraph. I'm going to turn it into 2 paragraphs. Medications to prevent the reoccurrence of anxiety symptoms. As a future possibility. Notice that when you misspell a word like I did with possibility here, I don't worry about it too much. I can just right click, select suggested spellings, and the correct spelling is going to be right there for me. Therapists will work with the parents monthly to improve parenting skills and maintain consistency, for example. Okay, I'm ready to compile this note. Here it is. This is my individual psychotherapy note. Here's the time and the date that I compiled it. The information showing on here. Look at how much we have. It took us really no more than about 3 minutes to manufacture this note. We got some good individualized information in here, including a mental status exam and what she talked about in therapy. We've linked to the treatment plan. Look at all this good information we have. We've talked about the progress that she's making. Talked about her clinical plan moving forward. We have a start and a stop time for our therapy. This would typically say Elizabeth Lobeo, psychologist, or licensed addiction social worker. Once again, in order to make this a legal document, all I need to do now is electronically sign it. Go back to the chart face. And we can see our individual psychotherapy note right at the top where it should be. It's been e-signed. Here's the date. Here's the initials of the therapist that did this note.